Okay, let's break down the medical bill. I was in the ICU for 3 days, and that was $6,500 a day. I had 3 different CT scans. The total for that was $10,000. I've mentioned that rifampin was one of the antibiotics I was on. It was $137 per dose.
A growing debate is unfolding as some Maga voters react strongly to comparisons between U.S. healthcare and systems in Europe, where coverage is often publicly funded. Why is this discovery sparking frustration? And what does it reveal about expectations at home? Listen closely as people share their personal stories and reactions.
I don't know anybody that lives in another country to confirm this, but those countries that people talk about, like France and Canada, are two I know of that have free healthcare. First of all, nothing in life is free. It's not free healthcare. It's free in the moment. Like when they go to the doctor, they don't pay anything, but they're paying for it somewhere through taxes, something, right? How are they paying way more taxes than we are? And so it's really like a wash? Or are we still paying more taxes than them and they are getting free health care? Like, I need to understand this system because our healthcare system is a disaster. Paying all this money every single month in premiums and then also paying all this money every single month in copays and stuff that's not covered. And it's a disaster. It's disgusting. And I'm like, well, if we could figure out where our tax dollars are going and stop sending them stupid places and then send them to whoever needs them so that we can have free health care and not have to pay outrageous amounts when we go to the doctor and the ER and surgeries and all that, why can we not do that?
On the topic of medical and insurance and all those things in the US, kind of crazy story, but last year my mate had to go to the hospital, the emergency room to get checked. They gave her a blood test, sent her home, and asked for like her name and details. A week later in the mail, she got her bill, which was $9,000 USD, 9,000. And that's all they did. Literally gave her a blood test. And when people are like in medical debt in the US and like these situations are crazy. Like it's out of hand.
Look, I'm not going to say any names, but a friend once told me, if you ever see me dying, don't call an ambulance. And I just kind of feel like that speaks to the essence of US healthcare. How sad is that?
Want to see what happens when you find out the average ambulance bill is $1,200 without insurance, $600 with? He's off, ladies and gentlemen. He is refusing an ambulance ride because of the cost. The problem in America is that our medical costs are so high that without insurance or minimal insurance, you can go broke paying your bills. This is a gentleman who had a shark attached to his arm, and he's refusing medical care because he's worried about the costs. This is a big problem. People are not getting the care they need because they're worried about the cost.
Europeans with universal health care. Do you like your system?
So I'm Australian, and while I wouldn't say that our Medicare is universal, it's pretty great. About a week short of a year ago, I was diagnosed with inflammatory breast cancer. It accounts for about 5 to 10% of breast cancer cases. The 5-year survival rate for standard breast cancer is about 91%. The 5-year survival rate for inflammatory breast cancer is 46%. That's terrifying. But this was contextualized to me by explaining the data is about 10 years old, and because it's a rare cancer, there's not a huge amount of data. But the big factor is, as a lymphatic cancer, there is no stage 1 and 2, and 1/3 of people only find it once it's metastatic, and the data comes from the US, where delay in diagnosis has negative outcomes, and the fact that this cancer is more common amongst African American people also affects the outcome. So ask me again.
I'm moving to Europe next year. When I tell people that I'm going there, a lot of times they get on me about the healthcare. They always harp on how, there's long wait times. You got to wait for months on end to like even see a doctor, which sure, that might be true. But my rebuttal is, what do you think we're doing here? Here, I don't have a doctor. I can't find a doctor. I'm a healthy, knock on wood, 28-year-old male. My insurance company keeps dropping me every year. I have to find a new one and establish a new primary care doctor. That takes about 6 to 8 months just to get seen for a checkup, like a, hi, I'm your new patient. Nice to meet you. From that point, if I need to ever see a specialist, I would have to get in with said doctor, have them write me a referral, and get another appointment with a specialist, which could take God knows how long.
You do not get free health care. You do not get free health care.
For those of you that think that people are wrong for wanting their taxpayer dollars to go to health care for everyone, just know that we give $10 million every single day to Israel for free health care. We just gave $40 billion to Argentina and probably more, and they have free health care and free education. We have $1 trillion that we spend on the military. We have plenty of taxpayer dollars coming in. It's just not where the billionaires want us to spend it. Republicans love war. They don't like helping people because it's not profitable.
I'm an American living in London, sharing my life there, and recently for work, I work in journalism. We made a film on the UK's care crisis. So in Germany, which this comment was talking about, the average family spends about 1% of their annual income on childcare. In the UK, that's a third of their annual income. So yeah, healthcare in Europe, much better than it is in the US, but healthcare in the UK is not as great as it is elsewhere in the continent of Europe.
The healthcare here in Europe is different. I live here in Germany, Berlin specifically, and going to the doctors with healthcare, I didn't know it could be so peaceful, because like when you live in the States, it is not peaceful. For example, if you go into the doctor's office or even dentist's office in America, like first of all, you don't know how much you're going to pay. That's like the stressful part. So you're like, all right, I know I got to get this root canal. I know I got to get this cleaning, but I do not know how much it's going to cost me. Even if you have insurance through your job, you're still not going to know. Whereas out here in Europe, well, let me say Germany, I don't know how it works everywhere else, but you can go into the dentist's office and they'll tell you how much you're going to pay before the procedure happens. In the States, you got to be comfortable with just being in debt before the procedure happens. Like, you're not going to know. Sometimes you ask the doctor, like, or the dentist, like, hey, how much is this going to cost? I'm like, I don't know. You got to talk to the front office. And you're like, all right, I mean, you've done a lot of these procedures. You don't got no idea how much. Like, can you ballpark it? And they're like, no, sorry, I can't tell you. And, you know, here, like in Germany, I asked the dentist how much. I even asked the dentist. The dentist told me how much I'm going to pay and asked me, am I okay with that? I'm like, oh, I had options? I didn't even know I had options.
I just had a patient tell me that him and his wife got quoted $30,000 to go through IVF treatment here in the United States. So instead, they are flying to Spain, staying for 2 weeks, making it a vacation, and doing IVF, all for $15,000. And keep in mind, he has insurance here in the United States, so that was with his insurance. And there, they don't have insurance. This is just out of pocket. So the out of pocket cost there, altogether, the trip, everything, $15,000. Make that make sense. Like, why? How? What is going on here? Healthcare just shouldn't be this inaccessible and inexpensive, especially, and keep in mind, he has insurance.
The one thing that I'm excited about whenever we do make it over to Spain is that it is cheaper, because I'm basically facing the same thing here in the US. We don't have socialized medicine, at least at this point, but it is so complicated to get to the right doctor, to get the diagnosis. We've seen everything about the US healthcare system, and it's not good. And I'm paying out the wazoo. So half the time, like right now, I have symptoms of certain things and I don't even go.
Let's go over what it's like to be 37 weeks pregnant as an American living in England and the cost difference between the two countries. I actually have 2 appointments today, one being a growth scan, which measures the size of the baby, and the next one is just a general appointment with a doctor to discuss my options for delivery. One thing about where I live in maternity care is they are really, really good. If your appointment is at 2 o'clock, you bet your ass that you're going to be getting into that room at 2 p.m. sharp. There is no waiting around, and it is very efficient. But one thing about England is you have a different doctor at each appointment, and sometimes you don't even see a doctor your entire pregnancy. But you are assigned a midwife at the beginning of your pregnancy, and you keep that same midwife throughout the entire time. Because my baby is measuring on the bigger side, I've had a few different growth scans this pregnancy, so I've just had a couple extra ultrasounds. Obviously in America, depending on where you live, if you have an ultrasound with insurance, you still get a copay. And if you don't have insurance, this ultrasound can be up to $1,000 per visit. I had a quick chat with the doctor about a few different things, and in America, that could cost up to $300, depending on what type of insurance you have or if you even have insurance. But for me being in England, it was free.
This is how much it costs to give birth in Germany. An American mom living in Germany, and I gave birth to this child 3 months ago, and I just got my bill in the mail. Let me first say I have private health insurance here in Germany, which is different for everyone, but for me, I have to pay for my health care in full, and then I submit that claim to my insurance, and my insurance reimburses me for it. I had a pretty uncomplicated birth. I did receive an epidural, and I was in the hospital for 3 nights afterwards, which is standard here in Germany. So the total for the delivery and all the care I received out to €3,395.10. And they broke it down. It's an itemized bill, and it is pretty standard. It's like the delivery itself was around €2,200, and then they charged me for like the room, the meals, and everything like that. But that just seems so affordable compared to healthcare in the United States. My health insurance will be reimbursing me this amount in full, but I will initially have to pay it out of pocket.
I'm an American mom living in Spain, and I've had a lot of questions about health insurance, what we pay for over here, and what that looks like. So let's get into it. First and foremost, we have private insurance. We pay €200 a month for myself, my husband, and 2 of our kids. If we were to go through the public health system, everything would be free. My son recently had his adenoids removed, so let's go through the cost and the process that it took within our private health insurance. First of all, our specific health insurance has specific hospitals and doctors all over Spain that we can go to directly. But for this surgery, we wanted to go to a specific doctor, so we just made sure that he was within our coverage and scheduled an appointment. So we scheduled the appointment with this doctor, showed up the day of, and he said, yes, your son does need to get his adenoids removed. Next step is to go visit the anesthesiologist and schedule the surgery. We then called our insurance company and they approved our surgery and everything was moving forward. And everything happened within about a 2-week period. Day of the surgery, we checked into the hospital, were provided a room. Surgery happened, we were provided lunch, we were in and out of there in 4 hours. It was very routine. Now, how much will all of this cost us? Absolutely nothing. It's all covered within our insurance within that €200 that we pay per month. The only cost that we might accrue extra is for the medicines or the prescriptions that are given for recovery. Again, if we were to have gone through Social Security or what is the free health insurance program, we wouldn't have paid anything at all for this procedure to be done. Today I'm sharing with you guys my experience with the healthcare system here in the Netherlands, specifically taking one of my children to the physiotherapy clinic here in Amsterdam. I'm an American mom from the US. We've been here for a few years now, and I love to share stories and experiences because I just love learning about how different countries, different cities do different things all over the world. So first off, one, I know nothing's free. I know we have high taxes. I know it's different. It's not comparing. It's not saying one country's better than the other. I'm just simply sharing what it was like for me today. So we pay €300 a month for basic Dutch healthcare. That's $150 for my husband, $150 for me, and then kids under 18 are kind of co-insured under that plan. You can add more features and stuff, but we just do the basic. That being said, we first went to the GP, told him about my son's neck and shoulder problems and that I wanted to see a physical therapist. And he said, okay, that's great. There's no referral required. Here are 3 by your area. Choose one, call them, make an appointment. That visit was €0. There's no copay. I'm not getting billed for that. So today we went to the physiotherapy clinic. They assessed him, did the stretches, movement, and I'm told that you get 18 sessions covered for the kids at no cost. That visit today was also €0, no copay, and we're not getting billed for anything.
From unexpected medical bills to stories of care abroad, these comparisons are raising tough questions about cost, access, and fairness. For some, it's eye-opening. For others, it's fueling deeper frustration with how the system works in the U.S.
So Switzerland spends 40% less on healthcare, but lives 6 years longer on average than Americans. So I am a doctor frustrated with the U.S. system, looking at other systems around the world. And right now I'm looking at Switzerland. And so the percent of GDP that the Swiss government spends, or the Swiss people spend on healthcare, is about 11 to 12%, but we spend about 16 to 18% of all dollars in the U.S. go towards healthcare. And they have a private model. There's no public health insurance. It is universal in that the government sets the rules, but you have to have insurance and you have to pay premiums, and how much you pay can be subsidized by the government if you're low income. But their system works. They live longer. They have high satisfaction rates. Yes, there is a high cost as far as premiums, and that's what the Swiss people complain about the most, it sounds like, but their total amount that they're spending on healthcare is still 40% less than what we spend here in the U.S. I think their model is very interesting and might have potential to work in the U.S., but we would need some major reform and probably some lifestyle changes. Our culture is different than over in Switzerland, and that might be one of our biggest barriers to having an awesome system like theirs.
Hey, remember when I came down with severe vertigo randomly on my birthday in October? And I had a doctor come to my house, and then I went to the emergency room, and then I saw a specialist all within 3 days. I just got the bill from the hospital, and I want to show it to you. Going to the emergency room in the US is something that you really try to avoid because it can be so expensive. Even if you have really good insurance, there's absolutely a €50 minimum copay at the time of the visit. And then usually there's going to be some sort of bill that comes after, even with good insurance because of deductibles, right? Well, one of the best things about living in France is that if you have a problem, you can go to the emergency room without fear of how that's going to impact your budget. Your finances are not going to take a hit for taking care of your health, which is a really weird concept for me as an American living in France. But I had severe vertigo. I was miserable. I needed to go to the emergency room. We have the bill here. €19.61 for the emergency room. And this will be reimbursed. So I'm going to pay them, but then Sécurité Sociale is going to pay me back. Like when I saw that letter in my mailbox and I saw that it was from République Française, I was like, oh God, it's a bill. It's going to be a lot. And I immediately felt this panic in my body. Like, how much is it going to be? I really don't want to spend like several €100 right now. Oh man, oh man. And then I was like, Amanda, just open the letter. Like the sooner you deal with it, the better. So I opened it, prepared to see a big number, because my American instincts still make me fear the worst. And I flip it over and I see under €20. It just makes me laugh and feel so grateful that I don't have to budget for my health.
The biggest culture shock for me after moving to Spain, healthcare. In the US, we were paying $2,400 a month for a family of 3, plus copays. Here in Spain, we pay $180 a month for a family of 3 total, and that includes dental. And that's it. No surprise bills after, no crazy deductibles, none of that. Spain actually has an amazing healthcare system that is actually free for its citizens, but when you're moving to Spain, you do require to have private insurance. Even that, it's way cheaper than what we were paying in the US. We all know that the healthcare system in the US is a for-profit system. Hospitals and insurance companies are all businesses trying to make money. Let me tell you that the service and the care here is excellent. The doctors don't really push you to do certain things. Unfortunately, that was not the case when I became a mother in the US. I felt like I was very pressured with her US doctor to do certain things that I was not 100% okay with. And that is one of the biggest differences that I've noticed.
I've had a few American friends ask us about our free healthcare here in England, which I know English people will chime in the comments that it's not free, it's paid for in taxes. I get it. It's still cheaper than American insurance premiums and all the copays and things that we had to pay after that anyway. But myself and the 2 kids, we're British citizens, so yeah, we get everything included. We can go to the doctor at any time. We don't have copays. We don't get big medical bills after. My husband had to pay into the system. He had to pay about £2,600 for 2.5 years worth of NHS services. And now he can go to the doctor and get taken care of too. I know a lot of comments will also say, oh, but in England, the wait times are so long to see a doctor. Honestly, it's not been nearly as bad as it was in Seattle. We waited 7 months in Seattle for a pediatric appointment for my son. We had multiple times where the kids were sick and we couldn't get them in anywhere to any doctor. And we had to go, people go to the emergency room instead at the hospital because they can't get into a doctor.
So I'm in a pharmacy in Spain. Do you want to know how much my albuterol, that normally costs like so much money in the US, just costed me? €4. That's like $6, guys. This is one of the many reasons why I decided to come to Spain to live, is because healthcare is just so much cheaper, especially if you're coming from the US.
So we're in Valencia, Spain, and my wife got sick, and she'd been sick for like 10, 11 days. It's not getting any better. Just really, really bad cold and flu symptoms. So finally I was like, let's figure out this Spanish healthcare and let's see if we can get you antibiotics or something. Within 20 minutes of deciding that we really need to get a doctor, she has her telemed appointment already scheduled and it started. The cost of this appointment is $29 with no insurance. We don't pay taxes. We don't have the benefit of free healthcare in Spain like a tax-paying citizen would have. But $29 to see a doctor effectively, or a telemed doctor.
So again, these are 100% out of pocket if you had no insurance in France. This bill is for 2
doctor specialist appointments with a hematologist, and 62 euros, 65 American dollars. This bill is for a prescription of some supplements that I needed, and the total out of pocket came to 5 euros for a 1 month supply. This one for a full blood workup, 68 euros, $70. This one is for my daughter's first dentist appointment, 30 euros, $32. These are the with copay prices in the United States, meaning that your insurance would be paying a lot more, and also you would be paying your company for this insurance plan. So for these being the totally out of pocket prices with no benefits, I just find it so interesting because it's just so much more affordable than we're used to in the USA.
The United States spends more on healthcare than any country in the world. Portugal spends far less, even when you count both the public system and their private system. I'm a doctor, frustrated with our system. I just explore healthcare systems around the world and share what I learn. And so Portugal spends about 10 to 11% of its GDP on healthcare. In the United States, that number is closer to 18% of GDP. And that Portugal number is already including everything, your public hospitals and your private insurance and your out-of-pocket spending all together. Now, if you only look at Portugal's public system, you'll hear complaints about wait times for certain specialist visits or elective procedures. But here's an important detail. Nearly half of Portuguese residents also carry private insurance. That private coverage lets patients access private hospitals and clinics, often with faster scheduling. So Portugal ends up with a hybrid system, a public system that guarantees universal access and a private sector that can speed things up. So even if you combine both sectors together, Portugal still spends thousands less per person on healthcare in the United States. One big reason is price control. Portugal uses national negotiation and government price regulation for many services, hospital payments, and medications. And the U.S. system relies more on market negotiations between insurers, hospitals, and drug companies, which often can lead to higher prices. Those are two very different approaches trying to balance access, cost, and outcomes. And if you like longer explanations, I do feature a different country's healthcare system every week in my free newsletter with the link in the bio.
Norway is known for its free healthcare, and I just had knee surgery here in Bergen. So people want to know, how much did it cost, and was it really free?
And apparently I went to a private hospital, which I didn't know. I just went to where my general practitioner, my GP, sent me. Does that mean I got better care, or that the doctors were better, or the surgeons were better? I don't really know. But I went to Harold's Plus, and I guess that is a really good hospital. This was my 6th knee surgery, number 6, and the 3rd on my right knee, and the first time I had surgery on my right knee since 2002. So it was 22 years ago. It's the last time I had surgery on this knee.
And I can tell you from the past that in the States, the different surgeries I've had on my knee, anywhere from $20,000 American, which is 200,000 kroner in Norwegian money. They're not cheap. They're definitely not cheap. But you're here to find out what I paid for here in Norway. So here it is. 461 kroner. That is what I paid. And I paid for it through Vips right here in a text message on my way home, and the Pasientreise, the patient taxi. And so if you're not Norwegian, what this says up here is it's just day surgery in the orthopedic area, and bandages and anesthesia and stuff like that with 75 kroner. And basically the deductible and stuff for my health professional was 386 kroner. And that's how we got to the total of 461. A knee surgery, and a good one. I mean, she did an amazing job. 461 kroner. So what is that in American money? Well, let's find out. 461 Norwegian kroner equals $43.73 in USD. That's wild. That is wild for healthcare. I mean, it's amazing. I feel so blessed and so happy to finally get this straightened out and just fixed. Oh man, I mean, everyone should have access to healthcare. And in the United States, you pay enough taxes. I don't understand why you can't have it, but hey, more reasons I'm thankful to live in Norway.
Okay, let's break down the medical bill. I was in the ICU for 3 days, and that was $6,500 a day. I had 3 different CT scans. The total for that was $10,000. I've mentioned that rifampin was one of the antibiotics I was on. It was $137 per dose. The echo they did of my heart, $4,000. The EEG was $10,000, almost $11,000, $5,000 a day. Medications were $4,600. The labs were $17,000 because we were really trying to figure out what was going on. Chest x-rays and stuff like that was $2,500. The respiratory services, including the ventilator and any oxygen I was on after, was $5,200. The emergency room was over $8,000. So as you can see, the total was $93,000. And almost 18 months later, we're still working with our insurance company to figure out how much we're going to have to pay.
The stories you've heard today highlight how healthcare remains one of the most personal and debated issues in America. For some MAGA voters, these comparisons to Europe are sparking new questions about affordability and access. For others, they reinforce long-standing beliefs about how healthcare should be structured. What's clear is that the conversation is far from settled. These perspectives show just how complex and emotional this issue continues to be. If this video gave you something to think about, share your thoughts in the comments below. Don't forget to like, subscribe, and share to help more people hear these stories. And click the video on your screen to continue exploring the issues shaping America today.